Before we dive in, subscribe for clear, science-backed videos that help you age stronger, think smarter, and protect your health. If there is one part of the day that most people completely overlook when it comes to blood pressure, it is the 10 to 20 minutes right after a meal. And if you are an older adult, that window can matter even more than most people realize. Because what happens after you eat is not just about digestion. Your blood sugar changes, your circulation shifts, your nervous system has to adapt, and in some people, your blood pressure can move in the wrong direction very quickly. So the move we are talking about today is simple, but the reason it matters is actually much deeper than it sounds. And the move is this: take a short, easy walk after you eat. Not a power workout, not a long run, not some complicated routine. Just a gentle walk, usually for about 10 to 15 minutes, starting fairly soon after the meal. But I want to be careful right from the start, because the title claim that this can lower blood pressure by 62% is a much bigger statement than the evidence actually supports. And that distinction matters because there is a huge difference between a smart habit that helps many people and a miracle promise that fits everybody. So in this video, I want to help you understand what this after-meal walk can realistically do, who it may help the most, and when it can actually backfire if you are not the right person for it. We are also going to talk about why some of the dramatic claims you hear online are mixing up blood sugar research with blood pressure research, and why that can be especially confusing for older adults. And by the end, I will give you a very simple framework you can use to decide whether this should become part of your routine and what questions to bring to your own doctor. And if we have not met before, I am Jessica Morgan. On this channel, I focus on helping you understand the science of healthy aging in a way that is practical and clear. My goal is not to overwhelm you with jargon. It is to help you understand what is happening inside your body so that you can have better conversations, make better decisions, and feel less lost when health advice online starts to sound loud, conflicting, or just a little too good to be true. And as always, I am here as an educator, not as your personal clinician. Nothing in this video is personal medical advice, diagnosis, or treatment. If you have heart disease, diabetes, kidney disease, dizziness after meals, episodes of fainting, or you are taking blood pressure medication or insulin, this is something you should individualize with your own healthcare team. My job here is to give you a framework and help you understand the trade-offs. Your doctor's job is to fit that framework to your body, your symptoms, and your medical history. So, let's get into it. Why the minutes after a meal matter so much. After you eat, your body does something pretty remarkable. It redirects more blood toward your stomach and intestines so you can digest and absorb that meal. At the same time, your pancreas starts responding. Your blood sugar begins to rise, and your circulatory system has to keep everything balanced so that your brain, muscles, and heart still get what they need. In a younger and more resilient body, that adjustment is usually smooth. But with aging, stiffer arteries, insulin resistance, medication effects, or autonomic changes, the system does not always adapt as cleanly. And that is why the post-meal period can become a vulnerable window. Now, if you finish eating and then sit completely still, especially after a larger meal or a more carbohydrate-heavy meal, your muscles are basically off duty. They are not helping clear as much glucose out of the bloodstream, and they are not contributing as much to the normal circulatory support that comes from movement. That does not mean sitting after a meal is inherently bad for everyone. But it does mean you are missing a really useful opportunity, because one of the easiest ways to support your metabolism right after a meal is to ask your leg muscles to start working, even just a little. And that is where the short walk comes in. Walking is simple, low skill, low cost, and for many older adults, it is much more realistic than telling yourself you are going to do a 45-minute structured workout every day. And physiologically, it makes sense. When your muscles contract, they can start pulling glucose out of the bloodstream to use as fuel. You also get improved circulation, less uninterrupted sitting, and a gentle demand on the cardiovascular system without the stress of intense exercise. That combination is exactly why walking after a meal keeps showing up as one of those small habits that can punch above its weight. What the evidence actually shows. Now, this is the part where things get a little more nuanced. The strongest evidence for walking right after meals is not actually about dramatic, immediate blood pressure drops. It is about lowering post-meal glucose spikes. In several studies, short bouts of light to moderate activity after meals performed better than staying sedentary, and often performed better than doing the same activity before the meal. In older adults, even 3 15-minute walks after meals have been shown to improve daily glucose control. And those shorter walks may be more realistic than asking someone to do one long workout every day. Why does that matter for blood pressure? Because blood pressure does not live in isolation. When you repeatedly spike blood sugar, you also create more stress on blood vessels, more inflammation, more endothelial dysfunction, and often more insulin resistance over time. And insulin resistance tends to travel with higher blood pressure, abdominal weight gain, metabolic syndrome, and a greater long-term cardiovascular burden. So when an after-meal walk improves the glucose side of the equation, it may also support blood pressure indirectly over time, even if the immediate measurable effect on your blood pressure cuff is not some giant overnight transformation. That distinction is really important, because when people hear walk after eating, they sometimes imagine a magical trick where blood pressure falls dramatically on the spot, almost like taking a pill. But that is not really how the body works in most cases. The more honest story is that this habit helps in layers. It can blunt the metabolic stress of the meal. It can reduce the amount of time you spend sitting. It can improve insulin sensitivity. It can make regular movement easier to stick to. And when walking becomes a true routine, that overall pattern can help lower resting blood pressure over time. And that longer-term effect is very real. Walking as a regular habit is associated with meaningful improvements in blood pressure, including in older adults. Not miracle-level changes, but real changes, the kind that matter when repeated day after day, week after week, month after month. A few points lower on systolic pressure may not sound exciting on social media, but in medicine, those smaller shifts can add up. They can mean less strain on arteries, less pressure on the heart, and a lower chance that you need more medication layered on top of medication later. So where does a number like 62% come from? Usually, when you see a claim like that, there are a few possibilities. One is that someone took a number from a very specific subgroup in a very specific context and stretched it far beyond what it actually means. Another is that they confused percentage changes in a glucose response with actual blood pressure lowering. And another is that they are using a click-worthy number because it sounds dramatic, even if it does not reflect what most viewers should expect in real life. This is why big health claims need context, especially when they target older adults. The overlooked twist. After meals, blood pressure can also go too low. Here is the part that almost nobody mentions in the catchy versions of this topic. In some older adults, the problem after eating is not high blood pressure. It is blood pressure that drops too much. This is called postprandial hypotension, and it becomes more common with aging. After a meal, more blood is sent toward digestion. To compensate, the heart and blood vessels are supposed to respond and keep blood pressure stable. But if that response is weaker, the pressure can fall. And when it falls enough, people can feel dizzy, weak, foggy, or even faint. This is one reason I do not love one-size-fits-all health advice for older adults. Because the exact same instruction that sounds helpful in a headline can land very differently depending on the person. If someone has untreated high blood pressure, spends most of the day sitting, and feels fine after meals, a short walk may be a wonderful habit. But if someone routinely feels lightheaded 20 to 40 minutes after breakfast, has Parkinson's disease, diabetes-related nerve dysfunction, dehydration, or is taking blood pressure medication that hits at the wrong time, then that same after-meal window may need a much more careful plan. And the symptoms here matter. If after meals you notice dizziness, black spots in your vision, unusual weakness, nausea, chest discomfort, fatigue, or that floaty feeling like you might pass out, do not just assume you are tired or getting older. That can be your blood pressure talking. It can also raise the risk of falls, which is a huge deal in older adults. We spend so much time thinking about stroke and heart attack that we sometimes forget a fall can be life-changing too. A broken hip, a head injury, a loss of confidence with walking, and suddenly the whole trajectory of aging changes. Now, interestingly, there is also some evidence that walking may help certain people with post-meal blood pressure drops. In one small study of older adults who had postprandial hypotension, intermittent walking at a usual pace appeared to blunt the drop in systolic pressure after a glucose load. That is fascinating because it tells us movement does not always worsen the situation. In some people, it may actually support blood pressure regulation. But this was a small, specific study in a specific group. So again, the takeaway is not everyone should do exactly the same thing. The takeaway is that the physiology is more individualized than the headlines suggest. Who is most likely to benefit from the after-meal walk? So let's talk about the person who is most likely to benefit from this habit. Usually, it is someone with elevated blood pressure, rising blood sugar, insulin resistance, pre-diabetes, abdominal weight gain, or a very sedentary lifestyle. It can also be especially helpful for people who tend to eat larger dinners, feel sluggish after meals, or know they are not consistently meeting their weekly exercise goals. Because one of the smartest things about a post-meal walk is that it piggybacks on something you already do every day. You already eat. Now you are simply attaching movement to that routine. And in older adults, that matters a lot. Adherence is everything. The perfect exercise plan that you do not actually follow is always worse than the modest plan you can sustain. Many older adults are much more willing to do 10 minutes after a meal than to promise themselves a formal gym session that requires changing clothes, driving somewhere, or waiting until later. Later often never comes. But a brief walk after lunch or dinner is concrete. It is anchored in the day. And because it is easier to repeat, it often becomes more powerful than the more ambitious plan that keeps getting postponed. This habit may be especially useful if your blood pressure problem sits inside a bigger metabolic picture. In other words, if you have hypertension plus prediabetes, weight gain around the midsection, higher triglycerides, or a family history of diabetes or cardiovascular disease, the after-meal walk may help multiple systems at once. That is one reason I like it. It is not just about blood pressure. It is a systems-level habit. It addresses the meal response itself, and for many people, that is exactly where the stress is happening over and over again, 3 times a day, every day. How to do it so it actually helps. The first question people always ask is timing. How soon after eating should you go? And the general answer is sooner rather than much later. For most people, that means somewhere in the first 10 to 30 minutes after the meal. You do not have to leap up from the table the second you finish your last bite. That is not the point. But waiting an hour usually misses the sweet spot where the glucose rise is beginning and the body is handling that meal. Earlier movement tends to be more helpful than delayed movement, especially when the goal is to influence the post-meal response. The second question is duration. And this is where people often overcomplicate things. You do not need a long walk to get benefit. Even 2 to 5 minutes may help a little, especially if it breaks up sitting. But for most people, I think of 10 minutes as the most practical minimum target, and 10 to 15 minutes as a very strong routine. If you enjoy walking and feel good, you can certainly go longer. But the beauty of this habit is that it does not demand a lot. It is supposed to feel doable enough that you can repeat it after breakfast, lunch, or dinner without it becoming another stressful health task. The third question is intensity. And for this, gentler is usually better. Think conversational pace. You should be able to talk in full sentences. You should not be huffing and puffing. This is not the time for hill sprints, heavy lifting, or trying to prove something to your fitness tracker. A large meal already shifts blood flow and places demands on digestion. Piling very intense exercise on top of that can feel awful, and in some people it can provoke reflux, cramping, or just unnecessary discomfort. The goal is not to crush a workout. The goal is to activate muscle and circulation without creating stress. And if you want to be extra strategic, dinner may be the highest yield place to start. Many people eat their largest meal later in the day. Many people also become the most sedentary after dinner. They sit, watch television, scroll, and then go to bed. That combination can make evening the perfect storm for a bigger glucose rise and a longer stretch of inactivity. So if doing this after every meal feels unrealistic, I often think dinner is the first meal to target. It is also where many people subjectively notice the biggest difference in sluggishness, bloating, or that heavy, I need to collapse on the couch feeling. What if walking is hard for you? Now, not everybody can go for a regular walk after a meal. Some people have balance issues. Some people have knee pain, neuropathy, spinal stenosis, severe arthritis, or they simply live in an environment where a post-meal walk outside is not realistic. And that is okay, because the deeper principle is not outdoor walking only. The deeper principle is post-meal muscle activation, marching in place, walking laps inside the house, gentle sit-to-stands from a chair, a few minutes of stepping side to side at the kitchen counter, or even repeated calf raises can still get the lower body involved. If balance is a concern, one of the safest ways to do this is to stay near a sturdy counter or table and just move in place. You could do 30 to 60 seconds of marching, then slow down, then repeat. Or a few chair stands, rest, then a few more. If you use a walker, a supervised hallway walk may be enough. If you live in a small space, simply walking from room to room for 10 minutes counts. This does not need to look impressive. It needs to be safe and repeatable. In older adults, consistency usually matters much more than style. The common mistakes that make this less useful. One mistake is turning a gentle after-meal walk into a hard workout. That usually comes from good intentions, but it misses the point. Intense exercise has its place, but not every form of movement needs to be intense to be valuable. The post-meal window is usually best used for easy to moderate movement. If you go too hard, you may trigger reflux, stomach discomfort, or simply make the habit unpleasant enough that you stop doing it. And the best habit is the one you can actually keep. A sustainable 10-minute walk beats the perfect 45-minute session that you skip 4 days out of 5. Another mistake is treating the walk like a permission slip for the meal. In other words, I can eat whatever I want because I walked after. That is not how this works. The walk is helpful, but it does not erase a meal. It does not magically neutralize excessive sodium, massive portions, or a daily pattern of ultra-processed eating. Think of it as support, not cancellation. It helps your body handle the meal better. It does not make the meal irrelevant. And when people understand that, they tend to use the habit wisely instead of turning it into a bargaining chip with themselves. Another issue is medication timing. This is especially important if you are on blood pressure medicines, diabetes medicines, or insulin. If your pressure tends to run low after meals, or if you already get dizzy after eating, adding activity without understanding your medication pattern can be risky. Sometimes the problem is not the walking at all. It is that the medicine, the meal, and the timing are creating a perfect setup for low pressure. This is why some people do beautifully with an after-meal walk and others do not. The body does not experience these habits in isolation. It experiences them layered on top of everything else you are already doing. And hydration matters more than people think. Older adults are often less thirsty, more prone to dehydration, and sometimes taking medications that shift fluid balance. If you are a little dry and then you eat a large meal and then you stand up quickly, that can be enough to make you feel surprisingly lousy. In some people, even drinking water before the meal may help support the post-meal blood pressure response. So if the after-meal window is a vulnerable one for you, do not just focus on movement. Also look at meal size, carbohydrate load, hydration, alcohol intake, and whether breakfast seems worse than dinner. How to tell if this habit is helping you. I think the smartest way to approach this is as a personal experiment. Try it for 7 days. Keep everything very simple. After one meal each day, preferably dinner, take an easy 10-minute walk. Not a perfect walk, just a real walk that fits your life. Then pay attention to 3 things: how you feel afterward, what happens to your energy over the next 1 to 2 hours, and if you monitor blood pressure or blood sugar at home, whether you notice a pattern change. You are not looking for one dramatic reading. You are looking for whether the overall response becomes steadier. If you have a home blood pressure cuff, this can actually be very informative. You might check before the meal, then again 30 to 60 minutes later on a day you remain sedentary, and compare that to a day you do your short walk. Not obsessively, and not 10 times in a row, just enough to learn something. If you consistently feel better and your numbers are stable, that is useful. If you consistently feel dizzy or wiped out, that is also useful. The goal is not to prove a theory. It is to understand your own physiology well enough that your routine starts fitting your body instead of fighting it. For people with diabetes or pre-diabetes who monitor glucose, the experiment can be even more revealing. Many people are surprised by how much different meals affect them and how much a short walk changes that curve. And even if your main concern is blood pressure, this matters because the blood sugar side of the equation is often part of the same cardiovascular story. I cannot tell you how many patients have thought of their blood pressure as one issue and their blood sugar as a separate issue, when in reality the underlying habits, meal patterns, and inactivity were driving both. When you should be cautious. There are a few situations where I want you to slow down and be more careful. If you have chest pain after meals, recurrent dizziness, fainting, black spots in your vision, severe shortness of breath, or you have actually fallen in the post-meal window before, do not treat this as a casual wellness hack. That needs a proper medical conversation. The same goes if you have Parkinson's disease, known autonomic dysfunction, significant neuropathy, advanced heart disease, or diabetes medicines that can push you low. In those cases, the habit may still be helpful, but it should be structured more intentionally and sometimes monitored. I also want to be careful with frailer adults who have limited reserve. If standing up and walking for 10 minutes after a meal sounds like a major exertion, then the plan should be scaled to that person, not to the headline. That might mean just 2 minutes of supervised movement, or a few supported sit-to-stands, or simply not lying flat right away. This is exactly the same principle we use with blood pressure targets, exercise prescriptions, and medication plans in older adults. We individualize. The right answer is not always more. The right answer is, what is the most effective thing this specific body can safely tolerate and sustain? The bigger lesson here. What I really like about this topic is that it teaches a bigger lesson about aging well. The most powerful health habits are often not the flashy ones. They are the small behaviors that match how the body actually works. A meal is not just calories. It is a physiologic event. It changes blood flow, hormones, blood sugar, vascular stress, and energy. And instead of leaving that whole event unsupported, you can meet it with one very simple action: move a little. Not because it is trendy, but because it makes sense. And it also restores a feeling of agency. A lot of older adults feel like blood pressure is something that only gets negotiated inside a prescription bottle. And to be clear, medication is incredibly important for many people, but lifestyle is not trivial just because medication exists. The walk after a meal is one of those rare habits that is simple enough not to intimidate people, but meaningful enough to move several health levers at once. It says to your body, I am not just going to eat and collapse. I am going to help you handle this moment a little better. So, does this one move immediately after eating lower blood pressure by 62%? For most people, no. That is not the honest takeaway. But can a short, easy walk after meals meaningfully improve the way your body handles food, support healthier blood sugar responses, reduce sedentary time, and over time contribute to better cardiovascular health and potentially better blood pressure control? Yes, absolutely. And that is actually the more useful truth, because it is real, repeatable, and much more likely to help you than chasing miracle numbers online. My practical bottom line: if you generally feel well after meals and you are trying to improve blood pressure, blood sugar, or both, start with this. After dinner, walk for 10 minutes at an easy, conversational pace for the next 7 days. If that goes well, consider adding lunch. If balance or mobility is an issue, march in place or do gentle, supported lower body movement indoors. If you get dizzy, weak, chesty, or strange after meals, stop and talk with your doctor before making this a routine. And if you are already tracking blood pressure at home, use that information. Let the body give you feedback. And when you talk to your doctor, the question to bring is not just, is walking after meals good? The better question is, given my blood pressure pattern, my medications, and how I feel after meals, what is the safest and most useful way for me to use that post-meal window? That is a much higher quality question. It opens the door to talking about postprandial symptoms, hydration, medication timing, frailty, glucose patterns, and whether your body needs a push, a pause, or a more individualized plan. That is where the real value is. I hope this was helpful. And if there is one thing I want you to remember, it is this. The goal is not to do something dramatic after you eat. The goal is to do something small, wise, and consistent that your future self will quietly benefit from. A short walk may not look like much in the moment, but repeated over months and years, it can become one of those habits that keeps your metabolism steadier, your body more resilient, and your health a little more in your control. Stay healthy, and I will see you in the next one.